Welcome to Morning Rounds with Morning Grounds. Too cheesy. Good morning, everyone. I'm Dr. Khan, and this is the first ever Morning Rounds. So let's dive right in. We're going to be discussing Lyme and little buggers called ticks. So there's a whole bunch of different kind of ticks out there, but the one that we're going to be focusing on is the deer tick. That's the one that causes Lyme disease. The fancy name for the deer tick is Ixodes scapularis. Ooh, fancy. But here's the thing. Ticks are just a sidekick to the whole process of Lyme disease. They're just a wingman to the actual bacteria that ends up causing the problem. Ticks are like the pinkies to the brain.
What are we gonna do tomorrow night?
The same thing we do every night, Pinky. Try to take over the world.
If you know, you know. So the deer tick is the one that has black legs, kind of like black stockings. Now, it on its own doesn't really cause any problems, even if it bites you. But the problem is that if the tick is actually carrying a specific bacteria that ends up causing Lyme disease, that bacteria is called Burgdorferi, Borrelia burgdorferi. So the tick, if the deer tick is carrying the bacteria Borrelia burgdorferi and it bites you and infects you, that is when you get Lyme disease. Now, Lyme disease is a whole world of a problem. It can affect your skin, your joints, your nervous system, your heart, everything. And while it used to be a problem in certain northeastern states, it's now actually a huge issue in Virginia as well. So let's dive right into the questions that you had asked. Let's get that handy dandy computer out. All right, so the first question. I was asked, what are the chances of getting Lyme disease from a single tick? Depending on where you live, anywhere from 1% to 50% of the ticks in that area are infected with the bacteria that causes Lyme. Since Virginia is now considered a high incidence state, it's pretty much a toss-up as to if you're going to get Lyme disease with one tick bite, so really 50% or more of a chance. Next question. When a tick bites you, does it leave a scar or a mark? So there's a material in the saliva of the tick that when it bites you, it introduces that into the skin. It kind of causes the same kind of reaction you would get with a mosquito bite. A little bit of redness in the few days after the tick bite. You can sometimes see a black spot in the middle of where the tick had bitten you. And that's usually remnants, body parts of the tick. Sometimes you'll even have a hardening, like a bump underneath where the tick bit you. Next question, how long does a tick need to be attached for disease transmission to occur? Great question. Equal to or greater than 36 hours. Treat or not to treat? Can you have Lyme disease without ever getting the bullseye? Yes! 70 to 80% of people end up getting erythema migrans, otherwise known as the bullseye rash. However, there's a good 20 to 30% of people who never end up developing a rash. Now, as far as treatment is concerned, that's a little bit tricky. Are we talking about prophylaxis or are we talking about actual treatment? So prophylaxis is when we want to give you an antibiotic to try to prevent you from getting Lyme if you were bit by a tick. However, you want to be sure who to give this antibiotic to. Prophylaxis means that if you noticed a tick on you and you're fairly confident that it has been attached for greater than or equal to 36 hours and that it'll be less than 72 hours when you would have been started on the prophylaxis. If you meet that criteria, then we give you one dose of 200 milligrams doxycycline to prophylax you. Now, if you were symptomatic with joint pains, fatigue, swollen lymph node, fever, then the treatment would be a more prolonged course with either doxycycline or any of the other two antibiotics, such as amoxicillin or cefuroxime. Next question. Once you have Lyme disease and clear active infection, how often should you be retested? Generally, we don't retest. This is because most people retain antibodies for a long period of time. This could be months to years. So the clinical picture drives the decision making. If you feel better, that's it, you're done. However, what if you get reinfected and you're starting to feel the symptoms of Lyme disease again? Well, at that point, testing you for antibodies doesn't really do much, because are these antibodies from previous infection or are these antibodies from the current infection? Either way, if you have those symptoms and the probability of you having Lyme disease is high, we would just go ahead and treat you at that point. Next question. Which test is the most accurate for Lyme? Does deep tissue massage help before a test? If you're going to get tested after a bite, you're going to have to wait a little bit, because it actually takes a few days to even a week for your antibodies in your body to occur as a response to an infection. So if you test too early, you might have a false negative. When you do decide to test, it's a two-step process. Both steps are required and can be done on the same blood sample. If the first step is negative, you stop, you're done. But if the first step is positive, you'll need to do the second step, and both steps need to be positive for it to be a positive result. There are several kinds of serological testing, and determining which one to choose really depends on the patient themselves and which stage of Lyme they're in, acute versus late/chronic. But all of them are immunoassays trying to detect antibodies. As far as the deep tissue massage, no, that has no effect on your testing. Should you send ticks for testing? Normally, no, and CDC agrees with that. Commercial labs that do this kind of testing are actually not required to have the high standards that a lot of clinical diagnostic labs are held to, and it's discouraged to use results of tick testing in clinical decision making. Here's the problem. If the tick test comes back positive, that doesn't necessarily mean you were infected. The tick may not have been on you for more than 36 hours to even have infected you. If the tick test is negative, then it gives you a false sense of security, because you could have easily been infected unknowingly by another tick that may have been on you. And here's the thing, if you were infected and are starting to have symptoms, I'm not going to wait for the results to come back for me to start your treatment, because it would take a long time for those test results to come back, and that would prolong treatment time, which is a no bueno. Removal of ticks. How do you remove them correctly? Use tweezers or protected fingers. You want to grab the tick as close to the skin as possible, and you pull straight up forcefully. No jerking, no twisting. Are there any good tick repellents? I'm going to talk about 4 of them. First one, DEET. It's a mosquito repellent and it's a tick repellent as well. I personally don't care much for it because it is a little bit more toxic. Second one is picaridin. Picaridin is less efficacious than DEET, however, it's a lot less toxic. Third, IR3535 stands for Insect Repellent 3535. It's basically an amino acid that messes with the insect's sense of smell. It's safe and is also recommended by the CDC. A lot of these out there are also combined with sunscreen, but please don't get that. Sunscreen needs to be applied throughout the day. However, when you're applying a product that has sunscreen along with IR3535, you are exposing yourself to too much of the product, and hence risking too much exposure to the repellent. And if you're really not comfortable with synthetic chemicals as repellents, then there is a natural product out there. Fourth, lemon eucalyptus oil repellent. Now this one is not super efficacious. Also, it wears off in about 30 to 60 minutes of wear, so you're gonna have to keep a spray bottle with you. There's also permethrin that you put on your clothing. However, the problem is that you cannot expose your skin to it. And when you're putting this product on your clothing, it's just too easy to wipe your face with, your sleeve, or it's just too easy to get it on your body. And I'm just not in the favor of it. And of course, don't forget the preventative measures. Make sure that you're wearing long sleeves, tucking your pant sleeves in your shoes, checking for ticks when you come back home from the outdoors, bathing after outdoor activity, and you can even put the clothes that you wore while you were out in the dryer on high heat for a short amount of time. Kills those ticks off. What other disease do ticks carry? So other than the deer tick carrying Borrelia burgdorferi, it can carry something called anaplasmosis as well as babesiosis. Neither one you want to get. Another type of tick to be aware of is the Lone Star tick. This one carries the bacteria for Rocky Mountain spotted fever, ehrlichiosis, red meat allergy, and STARI, which is short for Southern Tick Associated Illness, which ends up producing a red rash similar to what you see in Lyme disease. Alright guys, that's a wrap. If you found this helpful, please continue to leave me comments on posts that I put up for topics that may interest you. Please give me your questions. I'll try to address them as best as I can. See you next time on Morning Rounds.